SSRIs are among the most prescribed drugs for depression, but many patients and clinicians still don't fully understand how they work or whether they work at all. This episode dives into what we know, what we think we know, and why the debate still matters. So let's start with how SSRIs are supposed to work. Selective serotonin reuptake inhibitors, or SSRIs, target a chemical in the brain called serotonin. The basic idea is simple. Serotonin is released into the synapse, does its job sending signals, and then gets reabsorbed. SSRIs block that reabsorption or reuptake, which means more serotonin hangs around in the synaptic cleft, therefore increasing neurotransmission. This is where the classic chemical imbalance story comes in. Depression, we are told, is caused by low serotonin levels, especially in the synaptic cleft. Boost serotonin levels there and you fix the mood. Neat, right? Well, not exactly. The chemical imbalance theory has been challenged for years. Current research suggests it's not just about serotonin levels, it's about how the brain adapts to those changes. In other words, SSRIs don't work instantly because it's not just about flooding the brain, or rather the synaptic cleft, with serotonin. It's about the downstream effects, changes in receptor sensitivity, neuroplasticity, and complex feedback loops that take time to unfold. That's why patients are often told to wait 4 to 8 weeks to feel the full effect. That delay doesn't match the immediate increase in serotonin. So clearly, something more is happening, something we still don't completely understand. So what does that mean for efficacy? Do SSRIs actually work? Well, it depends on who you ask and how you measure it. Clinical trials have shown mixed results. For people with severe depression, SSRIs generally outperform placebo. But for mild to moderate depression, the difference can be small and sometimes even statistically insignificant. And that has sparked a lot of controversy. Are we overprescribing SSRIs for people who might not benefit much from them? One issue is how we measure improvement. SSRIs often help with mood and anxiety symptoms more than with energy levels, concentration, or sleep issues. So if a study is using a total depression score, those differences might be watered down. There's also the placebo effect. In some trials, placebo groups show big improvements, sometimes close to what the SSRI group reports. That doesn't mean SSRIs don't work. It means that expectations and the therapeutic setting play a huge role. Then there's trial design. Some studies exclude people with complex or chronic cases. Others don't track long-term outcomes. If you're only measuring 4 or 6 weeks out, you might miss delayed benefits, or for that matter, delayed side effects. Real-world response rates tell a more nuanced story. About 42% of patients report improvement after 4 weeks. By 8 weeks, that number rises to about 55%. That still leaves a big chunk of people who do not respond well or not at all. So how do we make sense of all of this? Well, for starters, SSRIs are not magic bullets. They can help, especially in moderate to severe depression, but they're not guaranteed to work, and they're not the only option. That's where clinical judgment comes in. Is the depression mild, moderate, or severe? Are there coexisting anxiety symptoms? Has the person tried therapy, lifestyle changes, or other treatments? An SSRI might be the right call, or it might not. The key is informed choice, and that means weighing benefits, risks, and alternatives together with the patient. It also means that we need to set realistic expectations. SSRIs are not quick fixes. They take time. They might only help certain symptoms, and side effects are common, especially early on. But when they work, they can be life-changing, and for many people they are a bridge to get to a better place where therapy, relationships, and self-care can take over. So where does this leave us? We're still learning. The science is evolving, but the message is clear. Depression is complex and treatment has to be tailored. SSRIs aren't perfect, but they're part of the picture, especially when used with care, caution, and in the right context. That's it for today, folks. My name's Dr. Ferghal Armstrong, and this has been Cracking Addiction.